K292FQ Riverside and K293CF Moreno Valley.
Many people were worried about their loved ones dying from COVID and didn't realize that they are at greater risk of dying from an opioid overdose than they are from COVID.
Yeah, there's a lot of kids out there that are taking medicine from their friends that they don't really know what it is. There was a girl recently on the news a few months back that she was 13 and she went to school and she had a headache, and so she asked for some a Norco from her friend or a Vicodin or something, and the girl got it from them, and it ended up being something called a blue, which is fentanyl, and she took it and she ended up dying. Her father found her the next day, passed away and overdosed in her bed, and she had no idea what she was even taking.
I didn't know she asked for something for a headache. I didn't know
Yeah.
that's what wow. That's horrible. And I was hearing stuff about these blues, what they call blues. And we're going to go into it on another show in more detail about what the drugs look like and what they are like. But I just wanted to mention that the blues are some blue pills that are actually fentanyl and can be smoked. And people will call them blues. So on today's show, we hope to help parents and individuals identify medications that contain opiates, also educate on steps to take during an overdose, and shed some light on brain chemistry and the struggle of someone dealing with substance abuse disorder.
Every day, 275 people in the United States die after overdosing on opioids, such as prescription narcotics, heroin, and fentanyl. Opiate emergency-related deaths can be prevented. There are laws set in place to prevent these from happening. They're called the Good Samaritan laws. They offer people legal protection to people who give reasonable assistance to those who are injured, ill, or incapacitated, also overdosed. You won't be charged with using or having drugs on you. And so there was one time when I've told this story, but I didn't tell what happened when I called 911. So I was homeless, and I saw one of my friends was overdosing. We were all sleeping by the bank, and we were all using by the bank. And it was maybe like 1 a.m, and there was about 10 to 15 of us there. There was a lot of us there, and because the dealer was right there. So we were all using together, and all of a sudden they're like, oh, hey, he's not moving. Is he okay? And so I went and I checked on him, and he was completely stiff, and he was making very shallowed breaths, like almost like gurgling. And so I pushed him down, and I'm like, he's overdosing. And everybody else took off and ran, and I was, except for two people, me and 2 other people. And so me at this point, I'm like 7 months pregnant, and I'm sitting there. I was 6 months pregnant, and I was sitting there giving CPR to him, and I could barely breathe myself. And I was like, somebody call 911. But everybody took off and ran except for this one guy. He gave me his phone, and then he ran off and left. So I called 911, and when the cops came, and they ended up coming over, they didn't ask us any questions. They just asked us about him and what he took and what happened. And then they took over from there, gave him CPR, and then administered Narcan. And after that, the guy got up. He was very confused and angry because he was sick from the Narcan, and he ended up taking off and walking away. They didn't ask him any questions. They didn't ask us any questions, and they just let us go after that.
That's awesome. So that's something to keep in mind. Under the Good Samaritan law, the police will not arrest you if you call, if someone's overdosed. And you don't have to run away, and you can stay there and administer CPR. That's the right thing to do.
Right, and they also can't violate you for probation or parole either.
Okay, that's great. And you said he was kind of mad, so when somebody is given Narcan, it depletes their receptor sites of the chemicals. So at that
point, so it kicks all of the drugs off of the receptor sites in your brain, and so automatically makes you start going through withdrawal, but like extreme withdrawal, and you feel it's like the most extreme of withdrawals all at once, and so it's painful.
It can be painful.
Yeah.
Okay, so I just wanted to go over a little bit about the types of opiates that are out there. There's prescription narcotic pain medication, and sometimes the medication is also just to treat like a severe cough. And there's also other conditions that it might treat, like cancer. The generic types are hydrocodone, morphine, oxycodone, and methadone.
There are also medicines in your medicine cabinet, over-the-counter meds that your kids could be taking to get high. And then a little known one is Imodium, the anti-diarrheal pill. You could take like 15 to 30 of those and get high off of them. Kids could. And I used to take them when I would be, sick. So I would take them, dope sick.
I never knew this.
This is when I was on the street.
Not
I
about
wouldn't
you.
have anything.
I mean, I didn't
yeah.
know that, but in general, that they could take that.
Right, exactly. And there's something else that's, it's called, it's hard to say, it's DXM, Dextromethorphan, and it's in more than 125 medicines. It's sold to treat symptoms of cough and cold. It's in Coricidin, Dimetap DM, NyQuil, Robitussin, and kids get these. They're able to get these from their parents' medicine cabinets or from the pharmacy, and they can just take a bunch and get high. It's dangerous. Is
that what's in that purple drink? Isn't there like a song about a purple drink?
No, that is, what is it called? It's something else.
Oh, sorry.
I can't remember what it was called, what the name is called, because it's something,
It's something else. Okay, well.
Codeine.
Oh,
it's codeine.
Okay, so maybe when we go over in a future episode, we'll talk about that as well. Okay, also there's more potent and illegal used opiate forms, which would be heroin, fentanyl, and fentanyl is 50 times more potent than heroin. And then there's also something called carfentanil, which I don't know that a lot of people know about that, but it's up to 1,000 times more potent than heroin.
There's a picture online if you guys go look. It shows, look up carfentanil dose compared to fentanyl and heroin and the overdose, how much it would take to overdose. And it's just little tiny specks that it would take to overdose from this carfentanil.
On the carfentanil.
Even the fentanyl as well compared to the heroin.
And sometimes those drugs, the fentanyl and carfentanil, are actually prescribed to manage severe pain that's associated with cancer. So if your loved one has cancer or you have the cancer pain medications in your house, make sure they're locked up. When my mom had cancer, we had her morphine locked up in a safe.
That was hidden behind a
And
picture frame. I didn't even know where it was. It was there.
A lot of people didn't know that she had a safe, but we had it hidden because we didn't want any of our relatives who had substance abuse disorder to be able to get a hold of it. That were there frequently, right. Yeah, to get a hold of that. And I think also it's kind of like a myth, I think. I would call it a myth. Maybe it's not a myth per se, but a lot of people don't realize that fentanyl is something that people actively go out and seek. So, so, I mean, things can progress. So you might begin like misusing prescription opiates.
It's actually really huge right now that people are going out and just buying fentanyl just purely because it gets them more high and it's cheap.
Okay. So it comes in like a pill form or?
There's powder and there's also a pill. I mean, the powder form is more potent than the pill form is, but it just takes a tiny, tiny bit to get high. So it's cheaper and you get high faster and more high. So that's why people are seeking that specifically.
Okay, yeah, that's why people are overdosing a lot.
Yeah,
of
if this carfentanil stuff starts getting out on the streets even more, it's going to be just catastrophic.
Let's hope that doesn't happen. So often people will start using prescription opiates and then move to heroin as a substitute, mainly because it costs less and it's easier to get. So
that's how it started with me too. With the heroin, it was cheaper than all the Vicodin, and it's kind of funny because I was thinking too at the time, I'm like, man, I am destroying my liver with all these Vicodins and Norcos. This heroin will be so much better for my liver.
Oh, Lord have mercy. Yeah, shooting up and then getting
But I didn't expect
is not the best thing for your
right. But
for
I didn't
liver.
expect to start shooting up either. I said I would never do that. I would only ever smoke.
That's the problem, right? No one ever expects to get addicted, and we don't think about the consequences and the actions.
But once it comes down to it, and you're in the thick of it, and you don't have the money for it, and you want to get high, and you're desperate, you do things that you never thought you would do, like shooting up was one of my main ones.
Right. So fentanyl, it's a synthetic opiate, and it's also a substitute that people use, and it also increases the risk of overdose because it's 50 times more potent than heroin. And when a person becomes dependent, the addiction occurs, and a person needs to use higher and higher doses of the meds to manage their pain or their symptoms. So that's what dependency is. And so oftentimes if they mix the medication or if they add alcohol, this is also going to increase the risk of overdose. What overdose is, it is when you get enough opiate, a chemical molecule that overwhelms your brain receptor site, and that blocks communication between your brain and your body. So when there's a lot of opiate in the brain, it's hard for the brain to communicate and remind the body to breathe. So it's just like blocking the brain's basic functions to tell your body, hey, breathe. So an overdose will look like that. It'll look like slowed breathing or no breathing, or the person might become unconscious or in a coma. And it only takes 3 to 5 minutes without oxygen for the brain to become starved without the assistance of some kind of naloxone or Narcan. Alyssa, I think you told us a little bit, but can you also tell us how the person looked who was overdosing, what you saw?
Yeah, not only was he really first stiff, and then once I threw him down, he went completely almost limp.
Why did you throw him down?
Because he was sitting up, and his knees were bent into him, and he was laying down on his knees with his head in his knees, and I couldn't get him. It was weird. I was checking on him, and I just kind of threw him down so I could start CPR. And
so your brain kicked into action. That's good.
Yeah, just like immediately I was like, oh no, I have to do CPR. That's just, yeah, it was like a fight or flight almost kind of response. It just, I knew what I had to do. But so there was clammy skin. Sometimes they turn blue and gray. I've seen multiple overdoses, and sometimes they have drool coming out of their mouth or froth or it's just really scary.
Snoring? You said snoring?
Snoring, loud gurgling, and loud snoring. And you could see sometimes when they're not breathing, or you could see when they're really, really slow breaths and really hard for them. You could see their chest,
Struggling to breathe.
Yeah.
Okay.
So that's why I feel like it's really important to have an opioid overdose recovery kit in your home. Especially if you or someone that you know spend time with an addict. There's 2 kits that they have, 2 types of kits, and there's 2 different methods of naloxone administration. Now, naloxone is the same thing as Narcan. Narcan is just the what's the word? The prescription name.
The term, maybe it's a generic.
It's the name.
Maybe it's
and then naloxone is the actual medicine that it is. There's the 2 that it is are an injection kit. So one that I believe is intramuscular, and then the other one is a nasal dose, and it comes with 2 nasal doses that you can spray up into their nose, which I have 2 of them at the house.
Right.
But you're supposed to store the kits too in an unlocked place, but out of reach of children, and also out of extreme cold or heat or sunlight. And then it's important also to check the expiration date regularly. So, you don't want expired meds in your house anyway, regardless. Some of the stores participate in a program that actually helps with free Narcan. You could call and make sure that they have them ahead of time and availability, because some of them don't have them all the time. But some of the stores that provide free Narcan are CVS, Walgreens, and Rite Aid. And yeah.
Okay. So in our house, we have some Narcan, and we keep it on top of the fridge. I would also recommend having Narcan in your car as well, just in case you might see somebody who's struggling with overdose. And I have witnessed that myself.
Right. And do you know what you would do if somebody started overdosing right in front of you? If you didn't have Narcan, what would you do? So the first steps that you would take is you need to call 911. That's the first thing. And then after you call 911, you need to start something called rescue breathing. So it's basically CPR. If the person isn't breathing and they're only gasping, rescue breathing is important, since the primary issue with an overdose is respiratory depression and not cardiac arrest. If you don't have, you begin CPR by breathing into their mouth. You have to completely cover their mouth when you do it, because you don't want any air to come out of the side of it, because you need to get it fully into their chest cavity, their lungs. They need to fill. You have to continue giving 1 breath every 5 seconds.
Do you plug their nose?
Yep. You have to pinch their nose closed and breathe into their mouth. Sorry.
Okay.
And you have to watch their chest rise and fall. And if there is no pulse, also you have to provide chest compressions. If the victim has a heartbeat but isn't breathing, or breathing by only occasionally gasping, you have to give rescue breathing. Tilt the head back slightly, check for breathing, and give 2 breaths, watching the chest rise and fall. If the chest doesn't rise and fall, reposition the head and continue rescue breathing. Now, this step is if you have Narcan or naloxone, which is the same. But in general, administer naloxone as soon as possible. But you
So
should
would that be before 911?
right here is you should call 911 first.
First, okay.
Yeah, definitely always call 911 first. That's the most important thing to do. Which again, you would be protected by the Good Samaritan laws. Which if you don't know much about, you should look into because it's really important for you to know your rights, just in case.
Right, and I've heard of people calling and having somebody at their house where their kids were, and the police didn't call CPS. Nothing happened to them.
Right.
So that's like even if it was to happen to you like that. That's
right. Exactly. And it's also important to call 911 first because the victim may have an underlying health issue that you don't know about, or maybe that you even do know about, and it's just important to call them first because of
they're
that.
the experts. We're not.
Right, unless it's dire, and they tell you to administer it. But if you're not going to call and you have Narcan on you, just give the Narcan.
Use the Narcan.
So now for the naloxone administration, it's really easy to do. The nasal one is really easy. You just peel back the package and remove the device. It's a little device that's white and red. You tilt the head back and you place the tip into one nostril and you use your fingertip to touch the nose at the same time. And it's just like a little plunger that you just like plunge into the nose and it gives the medication.
It's
That's
just,
it.
it's very much like allergy medication, like a nasal
Yeah,
spray.
exactly. And it has 2 doses in every one. So you would want to do the first one first and see if it works. And then use the second one if you have to.
Only necessary.
If necessary, yeah. And... yeah.
Okay, and so I'm going to talk a little bit.
No, wait.
Sorry. Alyssa's got something else to say. Go ahead.
Okay, so basically, when you're administering the naloxone, if the person is breathing, you're going to want to put them into a recovery position, which is placing them on their side. But you want to make sure that their mouth is downward and their chin is upward and their arms and legs are stabilized. You want to monitor their breathing and observe for side effects. If the person still isn't breathing, you need to continue the CPR steps. That's really important. Using naloxone for someone who is opioid dependent may result in severe opioid withdrawal symptoms, such as irritability and restlessness, increased heart rate, fever, runny nose, sweating, aching, nausea, vomiting, and or diarrhea, shivering or trembling, increased blood pressure, sneezing or yawning, goosebumps, and weakness. Now, those are all withdrawal symptoms. So, yeah, those are all the things that most opiate addicts have to go through when they're withdrawing in general, but it's just extreme, again, when you get the Narcan. However, opioid withdrawal symptoms should not be a reason to avoid the administration of naloxone. Sorry, for a life-threatening opioid overdose. They're not going to die from the withdrawals.
Right. So yeah. Don't be afraid of that, and don't be afraid of them getting angry because you're doing a life-saving technique.
Right. And even if they do get mad, like it happened to me too. He was so mad at me for doing that for a minute, but then I saw that he had posted something on Facebook. He said thank you to me too. He said thank you the next day. He's like, thank you so much for saving my life. Like nobody's ever cared for me like that before, and it made me really sad. He's a homeless boy too, and yeah, and he had posted online. It was like he was trying to get attention. He was like, I just overdosed and died, and I'm still here though. And nobody commented it or liked it, nothing. And I felt really bad for him. But but this severe withdrawal symptoms that happen after using naloxone, this is the same thing that happens when you take a prescription medicine called Suboxone before the opiate you're withdrawing from has fully left your system. Basically, like, if you were on, it's happened to me so many times, being on heroin or fentanyl, going to rehab, and you don't want to wait the full 24 hours. I mean, sometimes they make you wait 24 hours when you're in rehab, but even then, sometimes you can go into full on like withdrawal right after taking it instead of getting the relief from withdrawal that it's supposed to give, because if there's still opiates in your on your receptor sites in your brain, the Suboxone will kick off all of them from your brain. So it will instantly send you into withdrawals, which is hell. And there's been many times where that's caused me, not that itself, but mostly has caused me to say, I'm not staying here. This is making me way too sick. Like I feel horrible, worse than I would have felt if I would have just gently gone into it. You know what I mean? And
I'm confused though. Wait.
I left rehab and went and got high because I couldn't take the pain that I was feeling from being that sick.
So are you saying that they give you something to cause you to for all the meds, all the opiates to leave your brain so you can withdraw more quickly?
No. So basically, you're supposed to wait 24 hours because the opiates have left your receptor sites on your brain within 24 hours. And because it's a fast-acting drug, heroin, it's not like its half-life isn't that long. And so that's why when you take Suboxone, you're supposed to wait 24 hours. And Suboxone, it's supposed to help you, and it attaches to your receptor sites in your brain so that you aren't sick. But if you still have heroin on your receptor sites, it kicks them off immediately, which sends you into extreme withdrawal, which is exactly the same thing as naloxone does.
Got it.
Yeah.
Except naloxone doesn't have the calming effect, right?
Yeah, Suboxone is now, well, this doesn't either when it does this. But yeah, naloxone doesn't give you the same effect as Suboxone does if you would take it 24 hours after. It's not the same thing. So because Suboxone is naltrexone and this is naloxone. They're different medicines, but they basically do the same thing for when you have opiate on your receptor sites in your brain.
It blocks them.
Yeah.
Okay, got it.
It kicks them off.
And your point for saying that?
I was just talking about how it's painful.
Okay. I thought you were because I thought you had told me that at one point you knew someone who was who had overdosed and they gave them Suboxone also.
Oh, that did happen as well. They gave them, so basically somebody I know overdosed and they were doing CPR and CPR wasn't working, and they took a strip of Suboxone, a piece of it, and they put it under his tongue, and it revived him. He was like, he started breathing again, but then he instantly got sick and dope sick.
Because it basically did the same thing. It knocked out all the opiates off the receptor site so that the brain could start breathing. It could tell the body to breathe again. Right. Okay. And one thing we didn't say is we aren't doctors, so we are not giving advice as doctors or nurses or medical professionals. Right. We are just giving you an overview of some of the techniques.
I'm just an addict that's learned a lot of things about addiction and what to do in certain situations.
Yeah, we're just
because
telling you
of the things I've been through.
What to do in certain situations and giving you an overview of things that you can do. But we are not doctors, and you should research this on your own as well.
Yes.
Okay. Okay, so I'm going to talk a little bit about risk factors. Risk factors that can predict whether a person might have an increased risk of addiction. One, of course, that comes to my mind right away is going to be the genetic factor. Is there a predisposition? Is it in your family? Do you have family members who have issues with substance abuse disorder? To me, that's a major indicator that that you could become an addict, or so you could have an issue with a substance abuse disorder yourself. So that one is one that really sticks out to me. Yeah. There's also things that you can.
That's what I'm really afraid because for my kids, because I'm an addict and their father is an addict, and it's just a really scary thing to think about.
Right. Yeah. Exactly. And I think it's unfortunate. Unfortunately, I from programs out there that I've seen in schools and things like that, drug programs, I don't know that they point that out as much as they should.
Right.
And I think kids don't realize it. I remember first hearing a comedian saying something about his family members being alcoholics and why would he drink alcohol? And it was a joke. I can't remember the joke itself, but he was some people were always offering him alcohol, and he's like, I'm not trying to, I'm not trying to die. Are you trying to kill me, kind of thing? Mm-hmm. And it kind of hit me, and I I was probably in my 20s at that point, and I was like, wow, I never really thought of it like that, that because they are, I could be. I mean, I thought about it with drugs, but I guess I never
Right.
thought of it in terms of alcohol. And I never realized also how bad alcohol is for the body. And until, I had a friend who got really sick and had to go through the DTs and went into the hospital and the withdrawals. And then I realized, like, it's so hard on your pancreas, it's so hard on your liver. These are all things that as a young person,
We had a family member pass away
yeah.
because of alcoholism, because of, yeah.
But these are all things that I feel like kids in school need to know. Like,
Right.
how bad is this on your body? What can this do to you? And I know there's been some good things, like on TV, I've seen stuff like, I think maybe on Oprah, where they show what meth does to you, as far as like
Right.
your teeth and this and that.
Right.
And how
It's like
you
they're
look.
trying to scare them with physical appearance only.
Right, yeah,
More,
we don't
more
see
than
what-
anything. And then
but
the
that's
kids
probably
end
the-
up just making fun of them, and they're used in memes and jokes. And I've seen so many different things, like TikToks of homeless drug addicts fighting, and people think it's the most hilarious thing.
Yeah. So I think there does need to be more education regarding what alcohol can do to you, and also the fact that there's a genetic component for sure
Right.
in this. But other risk factors, I've gotten off topic, but other risk factors could be to look out for is influences from family and friends, the general quality of life, peer pressure, early exposure to drugs, stress, and parental guidance can greatly affect a person's likelihood of drug use and addiction. Development, the earlier drug use begins, the more likely it will progress into substance abuse disorder. This is particularly problematic for teens, as areas in their brain that control judgment and self-control are still developing, and they may be especially prone to risky behaviors, including trying drugs.
And this makes me think of too how a lot of people start using. They told us in rehab, they would teach us that a lot of people that use at a certain age, that's kind of the age mentally that they're stuck at. So like if you were 15 when you started using, your brain cannot grow because it's on drugs. It's inhibiting the growth of your brain, and you're kind of like at the mental capacity still of a 15-year-old.
That's how Grandma explained your dad to me when I was getting a divorce. She said, "When did he start using drugs?" No, I'm just kidding. No, she actually did. Yeah, that makes a lot of sense, though, doesn't
Yeah.
it? Like, because
And I know a lot of people like that.
yeah,
So
their
it makes
mentality
sense.
their mentality never went past that age, or it didn't to a certain degree. And it does take, like, I think I read like a year to two for your
brain to heal and start being able to properly your neurons to start connecting
create
the
new
pathways.
or
Yeah,
maybe even create new pathways. Right?
They do. You
Right.
do create new pathways.
The brain is beautiful. It's a wonderful thing.
Right.
Yeah, I think I was going to have something to say, but you interrupted
Oh,
me.
I'm
Now I've totally
sorry.
forgotten. No, it's okay. I was going to say, I think it's interesting too that in California, they changed the age. They changed the death penalty to be, I think, if you're under, like, I think it's 24, they will not allow a person to be put to death at the death penalty.
Really, I didn't know that.
Yeah, because your prefrontal cortex is not developed.
Right.
Fully developed until, I think, 24, and that is the area of your brain that understands actions and consequences.
Logic.
It understands that your actions that you're doing have consequences. So as a teenager, you cannot put those two together.
Right.
What you're doing right this minute is going to affect your future. If you use this drug, that's going to affect you.
Right.
So the young people, unfortunately, they don't always get that.
Right.
They don't see it, especially if they're not seeing it. Well, I guess not just especially, but in general. But I feel like in my household, we were kind of saved from that, my siblings and I, because we did see it.
Yeah.
Like when you see your relatives losing their minds and setting your living room on fire and stabbing your dog and all the madness, thinking the narcs are coming to get them. That's like something you don't want nothing to do with. You're like, heck no.
Right. But it still didn't prevent
It didn't prevent you.
in certain alcoholism that ran
Oh, yeah. We still
in the
had
family. So
alcoholism.
not
in our
you, but
Yeah. And that's the sad part with it too. I mean, when it comes to alcohol, I don't know. It's very sad to me that alcohol is like such an accepted thing and a rite of passage, that people do drink and they want to have this rite of passage. But then there's some people who can't drink and they drink to excess.
Right.
And I've never really totally understand why someone would want to pick up a bottle of vodka or Jack Daniels, and they even at a young age and just drink the entire thing. But many
I
people,
do.
you do. I've seen you do it. I've seen other people in my family do it, and it blows me away as a normie, as somebody who doesn't have that issue.
It does something
But
different to our brains, I think.
It
It's
does,
just
and that's the sad part about alcohol, right? Because drugs are so taboo, but alcohol is not.
right.
So, I mean, that's something else that young people should know. There should be some education on that too, and we need to really teach young people
Right.
to
And
look
they
at their
legal-
background and
sorry.
see who in their family might have that, the gene,
The genetic component.
Yeah, well, and there's a gene for alcoholism, and they need to see.
Right. And it's been proven.
Right,
So,
and if they can look back at their family members, and at a young age, if they're taught that, then they can go, hey, like right away, like I really shouldn't be drinking.
right. Because sometimes it's not even activated. What is the word? That gene, it could just be sitting there dormant until you actually eventually pick up a drug. If you do actually pick up a drug, and then all of a sudden it's almost like inactivation. You know what I mean?
Yeah, and it's been described to me by you and other people that when they've drank or used drugs for the first time, that's the first time they felt normal or comfortable within their own skin.
Yeah.
Right?
No, I wasn't socially awkward. That was my main thing. I had a hard time talking to people, looking people in the eyes.
And that's a risk factor. Antisocial,
Right.
people who are
I
socially
see. I wanted
awkward,
to be
that's a risk
social,
factor.
but I couldn't. I was too nervous.
So that's something also parents need to look for. Is your child really extremely shy to the point where
I was eating lunch in the bathroom.
they hide and and they're socially awkward.
I was passing gas before school.
Yeah,
like
you get nervous,
crazy.
you would get some stomach ache and nervous. Yeah.
Yeah.
So that's another risk factor that parents can look for. Also, it's important that you keep an eye on their typical behavior and watch out for changes in that behavior. Researchers have recognized several early warning signs. If noticed and addressed, they can probably help parents to confront the child before maybe the addiction occurs or the issues become advanced. Some of those include being secretive, strange excuses or lying, difficulty thinking or keeping focus, withdrawing from maybe their classroom or their grades dropping, and also resisting discipline or feedback. I know with Alyssa in the past, some of the things that I noticed was like she would become like really adamant about not letting me see her phone when she was up to no good or wanting something too much. I mean, I felt like anytime one of my kids, like if I would say no and their immediate reaction was like they would just throw a fit and become very determined or try a different route, I felt like, I need to be a little careful. And when she was using, I noticed that too. She would try anything.
You were a little controlling too back then, so.
Okay, there's that. Anyways, moving along. Some other things to look for are increased paranoia, irritability, anxiety, or fidgeting. And one thing I noticed with Alyssa, which I think I should have taken way more serious, her eyes became very like, oh my gosh, like glassy and tired looking and yellow. And the thing that she would do to back me off, and it worked, was to yell at me. Like I would be like, why are your eyes blah, blah, and she would just go off. And me just trying not to create too much of an argument. And also I kind of am that type of person who like, if I'm telling you the truth and you say I'm lying, I'm going to go off. So I think that she and her father both were very good at like going off when I was right on, dead on. And I would think, well, they're reacting like I would react. Like if I was being if I was accused of being lying, I would get mad. So obviously they're mad.
Right.
But the truth of the thing was, is they understood how to get me to back down.
Actually, I don't know what I was doing. I was just trying to make you go away.
Yeah, well, it worked. You knew what worked, right? So that kind of worked with me.
I don't think I knew it consciously. Maybe I knew subconsciously.
Well, it worked because, and unfortunately, I let you get away with that. You would be like, "I'm just tired. Leave me alone."
Yeah, but
whatever.
I was older.
You were older. Yeah,
at
you
that
were older.
point, so
You
it's
were
not
older.
like. I mean, you kicked me out. So what else could you have done? You know what I mean? At that
But
point,
I didn't for a long time. I mean, I feel like you were using in my house longer than I.
Well, not as much as you might think. I mean, it was just like as much as I could get my hands on, but it wasn't. I mean,
wasn't
at that
every day.
age, I couldn't. No, I couldn't find that much.
Wasn't every day.
No,
Okay.
that didn't happen until I was already 18.
Okay.
That's it. Then it went out of control.
True. Okay. Also look for changes in mood or attitude, significant weight loss or gain, loss of interest in hobbies or activities. Also, one thing with heroin that's really, really noticeable, they don't want to shower. They don't want to eat. They don't want to shower. They become dirty. They don't brush their teeth. I've seen this in my family where, individuals just smell bad. They get dirty. They turn dirty. They're not interested in going out and doing activities. They just want to lay around.
It's almost like signs of depression.
Yeah, that's a good way of putting it.
Yeah, but with dilated pupils and
Right.
and track marks and foil everywhere.
Foil, track marks, cotton balls. These are all things to look out for, and we're going to talk about that in our next episode.
Yeah.
Also, with students, you might see a decline in school performance.
Withdrawing from people.
Abandonment
that's the main,
of long-time
that's
peer
the most
group.
important one.
Yeah, that's what I was going to say. Abandonment of long-time peer group. They don't want to go out. They don't want to be with their friends.
You withdraw from your family, your friends, everybody. You just want to sit in your room and be left the F alone.
And then I read somewhere that, unfortunately, what's sad about it is, so say you have an interest in something, a hobby.
Oh, no, that's
like
gone.
play the guitar. Like you love to play the guitar. Now, all of a
See,
sudden, the
so-
things that used to bring you joy no longer bring you joy.
See, that was a big one a few years back. My baby's father, me and him were together for years already at this point, and he had this guitar he loved. He had it for so long. He had it from even before him and I got together, and he was great at the guitar, great at playing guitar. He still is, but one day we were really sick. We were withdrawing. We didn't have money, and he was like, "Let's pawn my guitar." And even though I was sick, I was like, "Wait, what?" I was kind of upset. I was like, "Why would you do that? That's your guitar." He's like, "Oh, I don't care. I just want to get some money." He's like, "I'll come back for it." And I was like, "Okay." So we went and he pawned his guitar, and we went and got some drugs, and he never got it back out.
Well, yeah, and that's a really good story, because that's kind of my point, is that I read that, the dopamine that you have in your brain that used to increase when you're playing the guitar doesn't increase nearly as much as when you use methamphetamines.
Right.
Right. So now it takes more and more dopamine to make you happy.
Yeah.
And those things that you used to love don't do nothing for you anymore.
Yeah, they don't feel the same. It's like it's the same thing with eating, sex, just any other thing. The levels, it's not the same. It won't be the same until your brain is healed, pretty much. And it may never all the way be the same, but it's still, because those levels have gone so high that you felt when you were on heroin or meth, it just doesn't feel the same. It's never as pleasurable as that pleasure that you have had.
Yeah, it's very
They taught
sad.
us that in rehab, and we were all like, "Oh, that makes
Yeah,
sense."
when
They
I read it,
drew
I
a
was-
graph. And
And I read about it. I think we talked about it at one point, but
Yeah.
it just blew me away. And it made a lot of sense, because that explains the withdrawal and the isolation
Right.
that people do. And if you see your family members doing this and they're not interested in the things they used to be, then, that's kind of a red flag. Also, they
Right.
might need more money. There might be an increased need for money, or they might not be able to account for where their money's going. There might be an abrupt change of friends, or they might introduce you to some new friends. There might be new people in their lives. Also, as the use progresses into abuse and addiction, some of the warning signs may become more distinct, and it's increasingly difficult for a person abusing alcohol or other drugs to function in their daily life. There will be increasing interpersonal conflicts, accidents, maybe, like car accidents, injuries. Stealing can also be an indication.
stuff can start coming up missing in your house.
Right, and that's that can be an indication of a serious problem. In the life of a young person, progressing into alcohol or other drug addictions, some of the negative consequences will build up over time. They may have they may have been having numerous conversations with concerned friends and family members. So you might see that. And then there's a compulsion and craving for alcohol or other drugs. And the person may this craving may increase until he or she has little or no capacity to manage the use. At this point,
Right, because the tolerance gets higher.
that's right. So what is tolerance?
Basically, in the beginning, you only need a small amount of something until you start getting used to it. Your body gets used to it, and you start needing more and more and more. So you could get that same or similar high or drunk that you did the first time. You're always seeking for that first high.
Well, there's a name for it. Chasing the
Chasing
dragon.
the dragon is,
Chasing the dragon.
and you never catch it. It's never the same. But it's still, yeah.
So if the high is never as good as the first high, why do people keep doing it? It's because they're looking for that first high, but what else happens if they don't?
You get sick, and you're just, your brain is dependent on it now. It's more to do with dependence than physical will. It overrides your physical will. Your will, or not physical will, I'm sorry, your will, just your will to overcome it. I mean, there's so many days I was on drugs, and I was just sitting there wishing I was able to just be sober. I wanted to be clean so bad, and I kept thinking, and I talked about that with so many addicts on the street, that we just wished that we could be clean, and we wished that we were never addicts, and we wanted to be clean so bad. At the same time, we're shooting up. It's like, it's a constant battle, because your brain is just dependent. And even when you're not physically dependent on it, mentally you are. So, yeah.
Right. It makes me think of like some of the stories you hear in childhood, like Pinocchio or whatever, when they don't listen to what their parents tell them to do, and then they have all these negative consequences. And it's almost like if you were a kid and you walked away from your parent in the store and you got lost, and then you were just like, I wish I would have listened to my mom and dad, or I wish I wouldn't have done this. It's kind of, that's what it makes me think of. Like, you're sitting there and you're going, I wish I had never tried this. I wish I would have
Right,
listened.
but then you also, in your state of mind, you start getting mad at things that aren't necessarily anybody else's fault, but you think they are. You're like, oh, well, I was born into an addicted family, and this is not my fault, because I was just born like this, or because this is in my brain, and this isn't my fault because this happened to me. I was raped, or I was beaten by my ex-boyfriend. I was, in a horrible relationship, and you just have all these excuses. That's what I call them now, but then they're legit, and they are legit reasons, but not to use, because it only makes things worse. You have to come to a point where it's just too much, and you finally, getting clean is more, what is the word, appealing to you than getting high is, in living another day the way that you're living.
I love that. That was great. Yeah. That's deep. I think that's very true.
Yeah.
Yeah, I appreciate that. I had a point to make, but I completely forgot it. But I think you said that very well. No, I mean, just when you were saying that in your story, I'm trying to remember what I was going to say, and I can't really remember. But I think that's very true. This is where we are.
Okay. So basically, we're going to talk about risk factors and protective factors. Risk factors increase the likelihood that a person will develop health and social problems. And protective factors help buffer young people with high levels of risk factors from developing health and social problems. The main points of understanding risks and protective factors, there's 4 relevant domains, and that is community, family, school, and peer and individual.
And of course, we're talking about students at this point, or children, young people.
Children or students, yes. Protective factors in the community include opportunities for pro-social involvement in the community, such as sports, church, drug prevention classes. Now, something that I do is because me and my kid's father are both addicts, so I'm really afraid that they will fall into the same things that I did or he did, because they're genetically predisposed to it. And so I like to make sure that my kids are into certain programs and stuff. Like, I take my daughter, I started taking her, she just turned 5, but I just started taking her to gymnastics, and I'm going to get her into Girl Scouts, and she's starting school soon. So on Monday, actually. So that's exciting. But
Yes,
it's good. So she'll have some social interactions. And also she goes to daycare, and so does my 16-month-old boy. So I think it's important to expose them to social situations with other people that are positive, instead of things that,
Could be negative. Well, I think too, when they're involved in sports, what I've seen is they're really focused on their health. They want to be healthy. They want to be athletic. To be athletic and to do all that they're doing, they need to be eating right. They're not going to be using drugs and alcohol.
Right, and it's good influence.
So that's a good thing.
It's good influences, good friends to have the kids around, instead of and not saying that other kids are bad, but they could end up being bad influences to your kid if they're not doing things like staying into programs that are socially developing them.
Keep them active.
Right.
Keeping them active. Yes.
So, and then also some of the risk factors that are family related are, of course, genetics, poor family management and discipline, family conflict, especially family, like fighting, a lot of fighting in the home, physical, mental, verbal, all of that kind of stuff is just not good for kids to see. Even talking bad about yourself or the other person, talking bad about themselves, and your kids constantly seeing it and make them start talking about themselves in a bad way. A family history of antisocial behavior and mental health issues, and favorable parental attitudes to the problem behavior. So basically very permissive parents, codependent. Yes.
Codependent parents who just say, oh, it's not my kid. Oh, no.
Right,
yeah,
exactly.
My kid would never do that, or making excuses for your kids. That also causes issues.
And it happens a lot. And sometimes I feel like the parents don't see it, or they want to think their kids are like perfect and sunshine, rainbows, and they don't want to see their kids doing anything negative. Not that their kids aren't great, but there's things that they're just not paying attention to purposefully, almost. Like, I don't know if it's a subconscious thing or if it's just being willfully ignorant, but it's really bad for your kids in the long run. It's
sometimes it's not genetics. It's like a cycle. So if your parents ignored your bad behavior, then you're going to ignore your kids' bad behavior.
You could, or it could be the opposite.
Yeah, it could be. I see it more to be the same.
I see it being opposite a lot more now. I mean, sometimes it does a lot trickle down into it in a way, but I see a lot of people nowadays going for completely different things than their parents ever did to them or with them, because they don't want their kids to endure the kind of relationship that they had with their parents.
Right. Okay, that could be true.
Right. So some of the protective factors are also family. Now, some of them include attachment and bonding to family, opportunities for pro-social involvement in the family, like family game night, fun things that you do with your families, play sports together. We used to play baseball.
Yeah, I love baseball.
That was so much fun.
I'm not great at it.
There was a bunch of us that would go out and play baseball together, and that was awesome. We don't do it as much anymore, and it's crazy because
I can't run anymore.
Well, have you noticed? I just noticed there's been a decline in the family unit, like our whole family, aunts, uncles, cousins, everything. Once we all stopped seeing each other,
right?
It's gone way downhill.
I think that there have
since your brother passed away,
right?
Almost.
Yeah, and then my brother was the one who kept us baseball, outdoors, doing everything,
dune buggies and motorcycles.
Yeah, I grew up like that.
And then once he passed away, we all stopped hanging out, and
right.
I think it was a bad
thing.
Well,
everybody's getting older too, and they're having families of their own, so that's part of it too.
Right.
Do you want to talk about? Okay, so I'm just gonna. My thought that I had earlier that you were talking about, and I'm gonna go over that.
Oh yeah.
I remembered. It takes me a while for my brain to compute things. So Alyssa was saying like how addicts can get into like blaming things and saying I'm this way because of my childhood, because of this and that. I just want to say that there was a time when you did that, and
I know
that was really hard. But what I admired about you, I immediately recognized it for what it was, because I grew up with people who were using, who had substance abuse disorder. And I just want to say that, like, I was really impressed with you when your attitude changed. And I think it was like right out of your first rehab, and you were like, you stopped blaming me and your dad and everybody else, even though you were still using. And I think that that's where some people, they need to come to that place where they're like, stop blaming everybody else, take responsibility for my own actions.
Because how
even
are
if
you,
you're not going to get out of it, but how are you ever going to get out of it
if you
if
can't
we keep
take responsibility?
lying to ourselves, right?
Exactly.
We keep lying, telling ourselves these lies and blaming other people. We never own up for ourselves. And we can never take responsibility for our actions.
Exactly.
So I think that's a big part of it. And I just want to say before the end of this episode that there is hope, because there's, Alyssa's definitely a case for hope. And there's other people who've come out of addiction and on the other side, and and I just want to encourage parents out there who are listening that there is hope for them and for their children, and that one day, things could get better, and just to let go of, don't hold on to it and think you have control of it, because you don't.
Right.
And when you let it go, when you let it go, then you don't have all that stress inside of you. You don't need to be holding on to all that stress and
You
praying
can
for
have peace.
Yeah, don't pray for this or that. I mean, pray for sure, that they get better. But I was praying that Alyssa would get arrested and this and that, and I went into a store, Hobby Lobby, and I saw a plaque that said, even if not, or it said something like, even if
No,
not,
I will still praise the Lord.
even if not, he is still good,
Oh,
or
yeah.
he is still good, or something.
Yeah, you have it.
And
so.
that's when I let go. I was like, you know what? I'm still holding on to this hope that she gets arrested. I think that I'm doing so
And
great.
then when I did get arrested and I called you, you're like, I was like, can you get me out? No, good. I'm like, oh.
But at that point, even I was like, this might not be the thing that saves her. But even if she dies, and it was a horrible thing to think.
Mhm.
But even if she dies, there's nothing I can do.
Right.
You know what I mean? And she's making these choices. I don't have any control over it.
Right.
And you have to stop trying to control other people.
Yeah.
I think that's Stoicism, and that's also Christianity, and it's probably
Let go and let
Yeah,
God.
to
That's
let
what we
go
say
and not try to
reha-
control.
or in
In
AA.
Oh, okay.
Let go and let God.
That's right.
Because that's all you can do. You have no control over it.
Yes. Next week's show, we're going to go over what to look for if you suspect a loved one is using, such as physical signs, drug terms and slang words that are used in the drug community, and then also paraphernalia. So parents and loved ones, please be listening. And everyone out there who is struggling with a loved one, struggle well.
We would like to dedicate this show to a friend of mine and a friend of my cousin Scotty's, who passed away of an overdose years ago, Jason Gilbert. Thank you for listening to Dying to Get Well on KCAA Radio, the station that leaves no listener behind. 102.3 FM, 1050 AM.
KCAA.
Yard House Restaurant of Temecula